Hello, everyone. Once again, I'm Casey Skeens, the Communications Manager at ACEEE. Before our speakers begin, I'd like to note a few logistics. All attendees are currently in listen-only mode. Following our speakers' remarks, we'll be opening the webinar up to questions. Throughout the presentations, please type your question into the chat box, and then we'll work to address them during the Q&A period at the end. This webinar has also been approved for credit by the American Institute of Architecture for 1 credit hour. So if you wish to receive this credit, please send an email to jrdenson@rdenson@aceee.org with your first name, last name, and your AIA ID number. And finally, this webinar is being recorded, and we'll send a link to registrants after the webinar. Before we begin, I want to quickly introduce our 4 panelists. We're joined by Sarah Hayes, the Program Manager for the Health and Environment team at ACEEE, Larry Zarkard, the CEO of the Building Performance Institute, the professional standard setting and credentialing organization for both the weatherization and home performance contracting industries. He was instrumental in moving BPI toward the new Healthy Home Evaluator certification and has delivered talks on the various ways that conditions in homes can negatively impact health of its occupants. Dr. Z. Smith, a principal and the Director of Sustainability and Performance at SQ Dumas Ripple, an architecture studio based out of New Orleans. His built work includes commercial, institutional, and residential projects, earning the highest levels of environmental certification and awards for combining design excellence with environmental performance and the promotion of occupant well-being. Kelly Warden, Director of Health Research with the U.S. Green Building Council. Kelly leads health-oriented applied research initiatives and partner engagements for the U.S. Green Building Council, and her work aims to propel action-oriented research on the intersection between built environment and public health. I'll now turn it over to Sarah Hayes at ACEEE to start us off. Sarah?
Thank you, Casey. Could I get the next slide, please? Thank you. So we have some fantastic speakers today that I'm really excited to listen to myself. And so I am going to keep it very short and really just share with you some additional opportunities for engagement around this nexus of health, environment, and energy. So later you can go back and look at these and maybe try some of these links. But one of the ways we have for you to engage is to participate in this webinar series. I have listed there some of the other upcoming topics that we'll be featuring, and there's a link there for more information. You can join a working group focused on strengthening partnerships and facilitating peer exchange across the health and energy efficiency sectors. That first link has more information about joining the work group. You can attend our upcoming conference on health, environment, and energy this January 22nd and 23rd in New Orleans. There's a link there. We are currently looking for speakers and sponsors. So if you're interested in either of those things, please reach out to me. Next slide, please. You can learn from some of our upcoming research. I've listed a few things here that you can expect in 2019 that we're working on. One is looking across programs and the approaches they're using to measure health impacts. Another is to identify opportunities to grade, blend, and layer health dollars with energy efficiency dollars for program funding. And a third is to look at methods for quantifying the dollar value of the health impacts that accrue due to energy efficiency programs. You can request technical assistance from us. That is something we provide to advocates, program administrators, and others in states and cities who are advocating for policy, have a need for policy analysis, or are looking for help with program design. And then finally, you could make use of some of our existing resources. We have done a number of different kinds of work products in this space, and so I'm not going to go through them all. I've just given some examples there, and the link at the bottom has everything in one place. Next slide, please. The last thing I wanted to share is just to let you know who's on our team and give you the contact information for those folks. So I am Sarah, first one talking, and then Cassandra and JR are also on the team, and you can reach them at the information provided. And that's all I have. Thank you.
Great, thanks, Sarah. I'd now like to turn it over to Larry Zarker, who will be presenting on training and credentialing opportunities for healthy home evaluations. Larry?
Thank you. Next slide, please. So my background is that I grew up in a home building family and went to, after graduate school, went to the NAHB Research Center and spent 20 years in building research, and then came over to the Building Performance Institute, working primarily on existing homes. So buildings really is pretty much all I know. Next slide. So I moved into a house in Maryland. It was over 100 years old, raised a family with kids that were very active in sports. And I recently wrote this blog, click next, and put it up on our homeowner site. It was about our kids were having sinus problems, and they were very active in sports. And finally, I used to allow BPI trainers to walk our house with their classes. Finally, the trainer said to me, you know, is your basement always this wet? I said, only when it rains. We were at the bottom of 2 hills, and he said, you know, you need to do something about this. And so all of the training that I had in buildings, finally I realized that I was the cobbler whose kids had no shoes. Next slide. That house was over 100 years old, and then we bought a house that was just 30 years old. So what could possibly go wrong? Next. Well, I see anything wrong with this bookcase? Next, this is a build. So you see that there was some rotting going on in the bottom shelf, and so we decided that we needed to pull the books and pull the trim, and here's what I found behind it. Next slide. So we removed the trim. Next, just keep clicking through this, and exposed the drywall, exposed the bats, exposed the framing. This is a concrete masonry wall, and so a little bit of moisture, next, came in through a corner, and you see that the heat pump slab was sloped toward the corner. So a lot of, when it rained heavily, we would get just a little bit of water, but it had no potential for drying out, and it caused all of that damage that you'll see in the next slide. A little bit of water can create a lot of havoc in a home. Next slide. Yeah, so that's what we experienced, and that's what a lot of people have in their homes, these kinds of factors that can negatively impact health. Next. And why is this a problem? If you look at, say, for example, asthma prevalence, intensity in kids under the age of 17, you see those darker states, 10% of the population has asthma, and that number is growing across the country. So we need to look at what are the impacts of this. You can go ahead and click 2 or 3 times. One more. Oh, yeah, and so the impact is that it can have a tremendous financial impact, both in terms of direct costs and also indirectly in terms of days missed in school, days missed from work when you're taking a child, and then of course there's the emergency room and the hospital stays. So asthma is very important. We decided that we need to understand what the triggers are that may cause it or may cause the incidents to occur. Next. So with a lot of help from people in the industry, including the Green and Healthy Homes Initiative, we created the Healthy Home Evaluator credential 3 years ago and brought it into the market. Now this is a pretty high level credential. It does require a diagnostic prerequisite certification like the building analyst. So it's not something that's aimed at, say, community health workers or in-home nurses, but I'll get to that in just a minute. Next. And on our website, you can click 2 times. There's a lot of information about the certification, what the job tasks are that we expect them to require, and then the circled area or where the arrow's pointing is a whole set of resources that we found and collected and made available for you to access for free. Next. So this is the current map. We have about 400 healthy home evaluators throughout the country. We expect that number to rise. We had to spend a couple of years training up our trainers so that they could do this. Next. This is a really interesting case study in Washington State. I heard it presented last February, and this was Judy Olson from the Tacoma Pierce County Health Department, and they had worked with weatherization plus health healthy home evaluators and their community health workers, and found that the two collaborating together had more influence on the health and quality of life outcomes of the patients they were working with. So this is a pretty interesting model, and we're trying to expand that now. Next. So we started with building science principles in kind of the entry-level area, and now we've decided we're creating a healthy housing principles guide. It's a reference guide, and you could go to the next slide. We're trying to make sure that it is at a level where it can work for community health workers, public health workers, and as Sarah said earlier, there is the ACEEE conference next January, 22nd and 23rd. There's a lot of background noise. We're going to have a 4-hour pre-conference training for the healthy housing principles at the conference.
Hey, can someone mute your line?
Okay, I think that fixed it, thanks. So we're going to hold a 4-hour training for the healthy housing principles on a pre-conference, January 21st in New Orleans from 1 o'clock to 5 p.m. There will be more information coming out on that in the near future, but you might want to mark your calendar so that you're aware that it's coming up. Next slide. I was asked to be part of a healthy housing working group that has some pretty big hitters in it, and what we want to do is raise the awareness of asthma and other conditions in the home. And so you've got the American Lung Association, the Allergy and Asthma Network, Green and Healthy Homes Initiatives, and others. And we're trying to focus on the medical community, focus on the insurance industry, focus on people in their homes to help them understand what they can do. Next slide. And one of the missions of this is that if someone has asthma, they get an asthma action plan. We want to couple that with an environmental action plan so that there are people who can come in the home and help them understand that there may be conditions in there that are negatively affecting their health. So with that, one more slide, and I'll turn it back over. This is my contact information. You can reach me on the cell or by email, and I look forward to the dialogue.
Great, thanks so much, Larry. I'd now like to turn it over to Z. Smith, who will be discussing case studies on low-cost net zero family housing. Z? Z, make sure you're unmuted if you're talking.
There, it's finally unmuted, sorry. Thanks for this. Next slide, please. And this is just the abstract. Next slide. Sure. So we'll be getting at the end of this seminar to this session to a few case studies, but just to kind of, because I know that this is ACEEE and we're interested ultimately in issues around energy, that I'll be talking about 3 cases that cover very different building types that show that you can combine adjustments that or conditions that can promote occupant health and productivity, but still achieve some pretty good energy performance numbers. We'll be talking about a LEED Gold laboratory building, a design for well certification office building, and a multifamily housing project that is under construction now that is targeting net zero with off-grid capability with enterprise green community certification. Next. So architects, it's interesting, in some sense, talking about health seems like different than what a lot of architects focus on, where we're usually trying to make a building that's beautiful or a building that's affordable, or as Larry's talk showed, sometimes getting the details right so that water doesn't end up where it shouldn't be in ways that catastrophically impact health. But in fact, the reason state legislatures regulate in the enabling legislation for how people get their architect's licenses, in almost every state it has a passage like this. In Louisiana, it happens to say, in order to safeguard life, health, and property and to promote the public welfare, the practice of architecture is reserved, and so on. And so it really means it's our job as architects to pay attention to health. Health, increasingly though, is not just about the long-term implications of what health really means. So next slide. But in fact, what matters is the short-term and chronic and immediate impacts on the well-being of building occupants. And so that can be not just about not being sick, but in fact promoting well-being and promoting productivity. And we're finding as architects in our own practice that it's this impact on day-to-day productivity and sense of well-being that is really driving what we used to call sustainability and energy performance, that the energy performance comes along for the ride if we design for health. Next slide. So just to review, what buildings need to promote occupant health and productivity? Obviously, we want to provide for thermal comfort. And a really important thing, we work on not so much single family homes in our practice, but larger buildings. And we are constantly battling facility operators who think that the way to make a great building is to put plastic boxes over all the thermostats and keep those pesky occupants from touching things. Our experience has been that your occupants are smarter than your building management system. They know when they're comfortable. And if they're messing with the thermostats, it means your building is malfunctioning. And as one building commissioning agent told me, that in 30 years of practice, he's never had a case where making people more comfortable made the energy use go up. It almost always makes the energy use go down. The second issue, no, please go back, is good air quality. And what we're finding is that the standards that are in place for ventilation and so on are actually woefully out of sync with the current best research on what it takes to promote good occupant well-being. We obviously want to control relative humidity for reasons that Larry's talk highlighted, because the high moisture situations can promote mold, and mold is the leading cause of lawyers in the built environment. And so we need to pay attention to that. For laboratories, which are typically very high ventilation and therefore high energy use building types, we find that giving occupants control to set ventilation according to what's appropriate to the work they're doing can have huge energy impacts that improve their comfort as well as improve the energy performance. We also know that buildings need to provide natural light used to nature, but that architects who try to do this by just making glass boxes are actually making the situation worse. And finally, one that's a little more subtle is promoting activity. We're such a sedentary society, we're an overweight society, and things that can promote more physical activity in buildings, like just making stairs more inviting places, can make a big impact on occupant health. Next slide, please. There's some recent studies that are quite interesting on that thermostat that we talked about. Berkeley has shown that in fact, building set points where the ambient temperature is much higher than what we're used to thinking is the quote comfort zone, in fact in offices promote the highest level of occupant satisfaction and the highest productivity. as long as we give people control of the rate at which air is moving in front of them. So at the desk, we have a situation where if you can have individualized small fans, which are very low power, a few watts each, you can deliver much higher productivity and much higher comfort with an ambient temperature in the summertime of as high as 79. Next slide. And in fact, recently in the news, it's become an issue. It's a gender equity issue where in offices, a recent study coming out of Germany shows that the test scores of men might be higher at lower temperatures, but next slide, women are especially significantly negatively impacted, even at the same level of clothing, due to differences in metabolism. And so the best thing to do is to provide a good ambient temperature and give people control over the rate at which air is moving over them, so that way they can control their perceived cooling, perceived temperature. And that also happens in office environments which are air conditioning dominated to save energy. Next slide. The other surprising bit of research that's happened that's really changing the conversation is some research that's sometimes called the Harvard study or the COG-FX study, the cognitive function study, where at a facility in Syracuse, New York, they built these uninviting windowless cubicles, but underneath each one of those, they're able to manipulate the carbon dioxide levels, the volatile organic compound levels, and so on, and temperature and airflow, and then study how knowledge workers perform as you vary these conditions in beautiful double-blind studies. And the results are stunning. They found that performance on the most challenging knowledge worker tasks can be almost doubled if we get the VOC levels lower and get the CO2, the indoor carbon dioxide levels lower. So if the middle bar is green, which is sort of typical of what you would achieve with a good LEED certified building, green plus is that plus a higher level of outdoor air to lower the ambient CO2 levels. Next slide. And in fact, they show this over a range. This research is all wonderfully documented and shows how this productivity varies by task, but that you would have to pay the average knowledge worker, to get a knowledge worker to score that much better, you'd have to move up a whole standard deviation in the bell curve of knowledge workers of what you pay them in salary. So you would have to pay that average, you'd have to offer a salary $6,000 a year higher to get that level of performance of average workers. You'd have to go for the higher tranche within the distribution of skill sets. So what this means is that the economic impacts of providing better air quality in office work are colossal and much bigger than, next slide please, the costs, no, go back one please, the costs associated with providing this higher level of ventilation. And the energy impacts can be managed using energy efficient technologies like energy recovery ventilation technologies and so on. This conversation has completely changed how we talk to office clients, and it's gotten us a lot of clients who have no interest in environmental certification, but have a huge interest in office and worker productivity. And then sometimes they just go ahead and perceive, once they say, we point out that, gee, since you've done this, this project would earn LEED certification, would you like to go ahead and do that? And it becomes almost an afterthought. So if we structure the conversation right, we can access lots of clients that currently are not interested in this. Next slide. The impacts are not just on day-to-day productivity, but things like sick days. Workers, some studies that have been done that show that workers that have the highest quality views and the best quality daylight actually on average take fewer sick days per year. And so that that money flows right through to the bottom line. Next slide. And productivity is both higher, and the rate at which clients can be, service can be provided to clients is also higher when you provide good daylight and good views. Next slide. Next slide, please. Thank you. And this translates also to schools. No, go back to the schools. Thanks. Where controlling for all other influences, they find that students progress 20% faster and 20 to 26% faster on tests year over year in the rooms that have the best daylight and views than those that have the least. Next slide. And daylit stores experience higher sales. And it depends on what the business type is and what the price point is in the stores and so on, these impacts. But the financial benefits of these are, we used to, 20 years ago, we talked about daylighting as a way to save energy because we could turn down the electric lighting. Daylighting is a way to unleash retail sales and worker productivity, and the energy savings just come along for the ride. Next slide. So some case studies just to show this in action. Next slide. So at the Dolney building at Georgia Tech, this building's opening next month. It's an office building where their original perception was they were building a parking deck, and they wanted to, building that parking deck would allow them to free up a lot of area that was currently covered in service parking and make a nice sort of green space in the heart of their campus. But then they're sort of embarrassed in a sense to have a parking deck up against their eco commons. And so they said, well, we'll put an office building, glue it onto the side of the building. Next slide. But what we did was, instead of laminating a building, we actually proposed pulling the building off from that parking deck, allowing things like cross ventilation and daylight from two sides on this incredibly long, relatively thin bar. So it's an office open plan workplace with just 40 foot from window to window, and allows for great daylight, great ventilation, and then through an application of what we call, next slide, a low friction VAV system, which is the kind of mechanical system that they're comfortable with maintaining at the campus through central plant people. But we are, by designing larger ducts that have slower turns, in addition to a lot of other measures, we were able to achieve a very high level of environmental performance, including qualifying for ASHRAE 189 certification, as well as WELL certification, even though this building is providing much more than double the typical amount of fresh air per occupant. And it's doing it at a cost of just $275 a square foot, which is a very low cost for an academic office building. Next slide. The Bioinnovation Center here in our home city of New Orleans was completed in 2011, and it earned a Co-Top 10 award as well as LEED Gold certification. Its measured energy use is 60%, 61% less than typical laboratories, even though we live in a very humid, hot, challenging environment. Next slide. Next slide, please. Thank you. A measure of how challenging our environment is embodied in that bar chart on the left-hand side of the screen. This is how much energy it takes to dehumidify and cool a cubic foot per minute of air flowing over the course of a year. As you can see, the only place where that number is higher is Miami. And laboratories tend to use lots of air because to keep people safe in case somebody accidentally tips over a container with some solvents in it or something like that while doing their work, when they should be doing it in a fume hood, sometimes people walking around a lab might spill something. So the kind of easy thing to do is to just move a whole heck of a lot of air, sometimes as much as 12 air changes per hour. However, this is a biotech startup incubator building where there's all kinds of different research happening. And so in each 1,000 square foot laboratory compartment of this building, we actually allow each tenant to set the ventilation policy appropriate to the kind of work they're doing. And as you can see in that middle bar chart, the energy implication of allowing the people who need a lot of ventilation to have all the ventilation they need, and those who need less to have less, allows tremendous energy savings. Next slide. And so, in fact, the measured energy use of this laboratory, this is energy use per square foot per year, is the yellow bar for this building, compared to the typical lab is about 1/3. And laboratories, as we say, are huge energy users compared to things like residences, offices, and so on. So these kinds of decisions of empowering users to make smart choices has huge impact. Finally, next slide. Is our net zero multifamily housing project currently under construction here in New Orleans. This is a 50-unit apartment building targeting supportive housing for veterans who maybe get undergoing care at the local VA hospital. And so the idea of losing power, which happens a lot here due to heavy storms, could put people's health at risk. So next slide. Next slide, thank you. We came up with a plan that said, instead of a typical energy use of a building or even Energy Star certification, we developed a package of measures on mechanical systems and building envelope that could cut that energy consumption in half. And we said, once you've done that, next slide, you could actually just cover this 3-story apartment complex with solar panels very affordably, and then in fact make the whole building able to island off the grid during power outages. And so this building is net zero and resilient based on this. And the total cost increment for that was only $22 a square foot. So it's really incredibly affordable due to the kind of the changes that are undergoing in the market today. Next slide. That's it.
All right, great. Thanks so much, Z. I'd like to now turn it over to Kelly Warden, who will be discussing U.S. Green Building Council's public health research. Kelly?
Okay, great. So you can go to the next slide. Yeah, great. So no, you can go ahead to the next slide as well. Yeah, so as I mentioned, my background's actually in public health, and so actually picking up on what we just heard in terms of the various ways in which the built environment impacts health. I always like to land on this slide, though, to kind of emphasize the growing interest from the public health community in working more closely with the building sector. And that comes from the fact that actually only 20% of health outcomes depend on healthcare. You go to the next slide. But as many of you know, and as was mentioned in our first presentation today, we spend a lot of money on healthcare in the U.S. And it's pretty insane when you think about how much money we spend, even though we know that actual increased access to healthcare does matter, but it's not what's driving most of our health outcomes. So you can go ahead to the next slide. In fact, many of those conditions that are leading to some of our highest health care costs are chronic conditions such as asthma and lung disease, as well as cardiovascular disease and diabetes and cancer, many of which share risk factors around physical activity and healthy eating. And those things are really impacted by living conditions, by the way that we're designing our communities, our cities, and even down to the building scale. So you can go to the next slide. So our health work at U.S. Green Building Council is really driven by a partnership we have with the University of Virginia School of Medicine that's been funded by the Robert Wood Johnson Foundation for about 6 years now. You can go to the next slide. And we focus on creating a self-sustaining market for health promotion across both public and private sectors of the global real estate industry in order to really get at the other factors that are leading to creating health promoting communities. So you can go to the next slide. And we get at that by using green building as a model and really leveraging the success of the green building movement. As was mentioned, there's a lot of synergies between green sustainable environments and health, but there's also an ability to be more intentional about prioritizing health within approaches to green building. You can go ahead to the next. So we work at a couple different scales. I'm going to focus today on the building scale in our work through LEED, but I'll also mention that we work closely with an organization called GRES, which is actually based in Amsterdam, that has a portfolio level benchmark for sustainability performance. And so we've worked to create health promotion tools, but both for built environment project teams, as well as real estate portfolio managers and investors. You can go ahead to the next slide. So as many of you might be familiar, health is a longstanding value of the green building movement. You look at the systems goals within LEED, these are similar to systems goals of other green building systems, and health is called out as a specific focus and goal. You can go to the next slide. But when you look at the actual weighting, you'll see that it's not necessarily the primary focus of the rating system. However, I like to land on this to point out that it's important to remember that building scale decision making has the ability to impact health at a variety of different scales. So while human health is called out as a 20% focus, efforts to mitigate climate change still matter for health. They really matter for global health, particularly when it comes to sea level rise and all of the extreme weather events that we're seeing, and that has a negative impact on human health. Additionally, water resources are really important. We need water in order to sustain life. Biodiversity is important and so forth. And so we're able to think about how to impact and promote health at both the occupant scale, which is what we're kind of focusing on with this webinar today, but also community scale, regional scale, and global scale. And so it's important to keep those things in mind, and so that we're able to take a balanced approach to building healthy, sustainable places. You can go to the next slide. And now we're in a time when we've got even more tool sets to really focus on health specifically at the building scale. So there's existing health-related strategies within green building systems, such as LEED and Enterprise was mentioned in the past presentation. And then you've got these new health-focused systems like Fitwell and Well that provide additional, really specific health strategies to focus on occupant health. You can go to the next slide. And while that's really exciting, what we also know is that the green building has been around for a long time, and it's a global movement. There are, in many cases, existing regulations or incentive structures that either require or encourage the use of green systems. And there's a lot of inherent value in the strategies that are held within green building systems. So you can go to the next slide. So a few years ago, recognizing all of these things, our team partnered with Enterprise Green Communities and the Health Impact Project to really define a systematic process for promoting health and well-being within existing green building platforms. So we wanted to provide green building practitioners with a way to tap some of that existing health promotion value of those systems and be a bit more intentional about how to promote health within green building. You go to the next slide. So this process that we created, it's available for use within both LEED and Enterprise Green Communities. And it's able to be boiled down to these 4 different steps. The first one, which is engaging community and public health expertise. And you use that engagement to create an understanding of the specific populations that are impacted by that project and what their health needs might be. And then the third step is prioritizing action according to needs. And the fourth is evaluating impact. And we've used this process to kind of flip the conversation to allow systems like LEED and Enterprise to be adapted to the specific context and needs of the project at hand. So you can go to the next slide. This is the version that's available for use within the LEED pilot credit library within LEED BD&C. And you go to the next slide. I'll just go through the 4 overarching steps. If you take a look at the language that's actually available online, it seems a bit overwhelming, but boiling it down, this first step is really around engaging new stakeholders that have new types of understanding when it comes to health and human impacts of projects. And we've been able to work with a variety of projects to apply this process. It's really relevant within a variety of space types. And what we've seen across the board is that it's actually, there's often times where there's existing health expertise within the client organization that hasn't previously been engaged. So here's an example at a medical office building in Virginia, where the facilities team worked with the community benefit team of the healthcare organization to build a better understanding of what the specific health needs are of both the staff working at this office, the patients that are going to be visiting the office, and also the community around the office, and build that understanding into their approach to LEED certification in a way that hadn't been done before. We're also currently working with the DC public school system to do something similar. Public school districts have a variety of health experts on staff when it comes to nutrition or nurses or physical education, and these experts aren't usually involved in the facilities discussion at this early stage. And we're seeing that bringing in these new perspectives really opens up new understanding and new opportunities to act on promoting health through specific building design, construction, operation strategies. So you can go to the next slide. So after engaging these new stakeholders, you go through a health goal setting exercise. And this is an example from an affordable housing development in San Francisco, where they built health into their community engagement process in a more intentional way than they had before. We're also seeing and hearing from folks that actually health is a really great way to engage tenants. We've heard from some commercial real estate companies that many times tenant engagement, specifically for the purpose of energy efficiency when it comes to controlling the thermostat or making sure you're diverting your waste properly. Sometimes that can be difficult. Tenants aren't necessarily interested in having that conversation, but using health outcomes or human experience as a reason to begin the tenant engagement process, we've heard is an easier way to start the conversation. And we've also heard that once you have that line of conversation, you can then build in conversations around the energy, the water, the waste goals as well. So you can go to the next slide. So after setting these health goals, the next step is really to take action on those goals by prioritizing specific strategies within your approach to LEED certification. So if those that are familiar with LEED know that it's a very flexible tool, which means that the project team and the practitioners have a lot of choice over which strategies they choose to prioritize and achieve. And so with this process, you're able to really prioritize those strategies according to these explicit health goals. And at times, this involves also bringing in additional health-focused strategies from other rating systems, such as WELL or FitWell. And so this is an example. The Colorado Health Foundation office in Denver is a really incredible building. They actually took, from the very beginning, a very intentional approach to considering health impacts of their building project. And they very explicitly considered health not only at the occupant level, but also thought about the community and wanted to really highlight the global health impact as well. And that led them to pursue both WELL and LEED Gold certification. You can go to the next. And so then the fourth step is around monitoring impact. And at this early stage, when this process is being applied, the purpose of having a conversation around monitoring impact isn't necessarily to begin the monitoring at that specific time, but it's to highlight that the decisions that you're making when you're deciding which strategies to implement at the design phase have expected outcomes that could be measured and could be monitored. And so we're encouraging this conversation to take place at that time when those decisions are being made, so that different types of metrics could be documented, so that down the road, if the owner and the client has the ability to monitor impact of these strategies, then there's some documentation around different types of design metrics or operations metrics or ultimately health metrics that could be measured. One thing I like to point out when the monitoring conversation comes up is that we have to be very mindful of the expectations that we're placing on our buildings, and think really critically about what are some early indicators, some proxy indicators, or some environmental indicators that we could measure to make sure that the space is performing in the way that we intended it to, that then maybe we hope lead to different types of health behavior changes that then down the line would hopefully lead to different health outcome changes. And we can use public health research to back up that kind of progressive approach to monitoring. I think we have to be really careful not to overestimate the ability to have an immediate impact on health outcomes when you're talking about things that depend on behavior. It's a lot easier when you're talking about air quality because that's more of an immediate thing. But when you're talking about active design, stairwells and things like that that are encouraging physical activity, or daylight and views, biophilic design that's meant to promote social well-being, those types of things take longer to have an impact and are a bit more difficult to measure. And so having an intentional discussion about that early on in the design phase can set you up for success when it comes down the line to actually monitoring the impact. So you can go ahead to the next slide. So that overview is of the specific strategy that we have available for use within the LEED rating system. We also this year just announced a Building Health Leadership Award that aims to recognize green building projects of a variety of types that basically go through that same process, in that they plan for health, they take action for health through green building certification, and then they strive or they aspire to measure outcomes. And we applications are currently open. We also, if you go to the next slide, we awarded a few initial recipients earlier this year. We were able to award Sandia National Labs, which is a huge corporate campus in Albuquerque that took an intentional approach to planning for health at the campus scale. So they really, through their approach to LEED campus certification, thought about what are their overarching health goals and how can they embed those in their approach to LEED. we also were able to award the 428, which is a really cool building in St. Paul that is an office building in downtown where they were able to combine both LEED and WELL in an interesting way. And then the DC Public Schools, which they are actually applying this process similar to Sandia up at the portfolio scale, but then they're using it to drive decision making at 4 different schools. So we were able to award these initial projects. No, it's okay. You can go to the next slide. We were able to award these 3 initial projects, but as I mentioned, applications are still open for award at the Greener Builder Conference in San Francisco this July. And you can access the application if you have projects that you think might be a good fit at our project website, which is greenhealthpartnership.org. There's a leadership tab up at the top of the page that has information on the Leadership Award. And then there's additional information on our project website about the various tools that I talked about. So thank you very much for having me and look forward to the discussion.
Great, thanks so much, Kelly. We're now going to move to the Q&A portion of the program. Great, thanks so much, Kelly. We're now going to move to the Q&A portion of the program. We have a question for Z.
Yes.
So the question is, for the Bioinnovation Center, were any measurements taken to understand if user-controlled ACH was being changed appropriately for contaminant levels?
We didn't monitor contaminant levels. We worked with the safety officers involved. Remember that the bulk ventilation of laboratories is it's event-driven. It's not due to that there's kind of continuous output of contaminants, but rather that when an accident happens when people are using elements where they shouldn't be. In some buildings, there are continuous monitoring, like, for example, using an air acuity system, and that can be very powerful. That wasn't implemented here, but in 8 years of operation, they've actually never had, they have the system allowed if you've set the requested ventilation level low, if an event happens, you can hit that panic button that takes it to 12 air changes per hour. And they've actually never had an event where that's happened. So that just shows how often and to what extent we tend to overventilate labs out of kind of a one-size-fits-all approach.
Great, thanks so much. We have another question for Kelly. There had been a pilot lead credit for the use of clean construction equipment in the construction renovation of buildings. Does USPC still provide this? And is there anything you can share regarding the use of clean construction equipment?
I am not familiar with that particular credit, but I think the question highlights the fact that there are opportunities to think really critically about how decision-making at all various points of the development process has an impact on health. And so I think it's important to consider not just at the design phase, but the construction phase, how your decisions are impacting health, not only of the construction workers themselves, but also thinking about material selection when it comes to supply chain impacts and things like that. So although I'm not familiar with that particular pilot credit, if you want to follow up with me, I can connect you with the expert on the lead team that oversees the pilot credit library, and we can get more information on it.
Great, thanks so much. Another question for Z. For St. Paul's example, what was the design goal for islanding, e.g. battery capacity in terms of hours of capacity to be able to run an islanding mode? Z?
There, yeah, you had to unmute me. Could you repeat the question then? Preparations for islanding mode?
So for the St. Paul example, what was the design goal for the islanding, e.g. battery capacity in terms of hours of capacity to be able to run an islanding mode?
Right, and so it's interesting. We could have done it as an absolute threshold of we want to be able to run in any condition for a certain number of hours. What we did was the capacity was set according to what the average daily consumption is. So the annual average daily consumption is targeted to be around, I believe the number is around 250 kilowatt hours. And so we, between 250 and 400, and what we did was we set that number, that target of 300 kilowatt hours of storage to get them through the average day. On the worst days, that's calculated to give them 4 hours of islanding at maximum power drain. And then on typical days, it allows basically the building to freewheel. In between, what we'll be working with the tenant management organization is a management strategy. It turns out that because these buildings are ventilated a unit at a time by the unit, there's an ASHRAE 62 driven system that automates how fresh air is brought in. That system needs to operate, and the most economical way to build this was to build that integral to the cooling system. And so we couldn't turn off cooling without turning off ventilation. So the system actually can provide thermal comfort throughout even the most dire conditions. What it gets dicey in is if it's Thanksgiving Day and they're all running their ovens at the same time. So there's a load shedding system which is more socially based using phones and texts. So we're going to have to learn how well that operates during power failures. But we get, in the last 9 years, there have been 6,000 separate events across the service territory of our utility where either individual buildings to blocks and so on have gone offline. And so we're going to get more and more experience with how that system works. And the utility is actually a partner in this because they want to understand how these social systems, rather than rewiring every building to have load shedding wired in, how that can work.
Okay, great. Here's a quick question for Kelly. One of our questions is that they've heard in the past the project could score well using LEED criteria, but with minimal IAQ improvements. Has that changed?
Well, no. So actually, that's what I meant in terms of the flexibility of LEED in general. Is that you can get to various levels of certification by prioritizing whichever aspects of the rating system you want. I mean, there are baseline prerequisites, of course, but then from there, you can get to LEED Gold, for instance, without necessarily, by kind of doubling down on the energy efficiency portion and not necessarily bringing in those indoor environmental quality aspects. And that's what we're really trying to highlight with this process, is the ability to prioritize different aspects of the rating system, and then we're hoping to reward and incentivize and celebrate those leaders that choose to prioritize the health aspects of the system.
Great, thank you. This is for anyone. Would anyone like to comment on the relative importance of exterior lighting design and light trespass with regard to the growing proliferation of LED lighting with high blue spectrum component and like the impacts on human health?
I would say from the research we've done, I think it's a really interesting and incredibly quickly changing field. One of the things that I've learned that's interesting, was brought to my attention, is that most of our studies about circadian rhythm influence are done on experiments on mice, on white mice, which is the best model in laboratories. Standard white mice are in fact nocturnal. And so a lot of the research that we have based these studies of circadian rhythm cues are based on an animal that's not a diurnal animal. And so some of this research is kind of going back to basics and being proved again. So with that said, I think that the blue mix that's available in certain white lighting, LED white lighting, can be of concern. I think it will be different 2 years from today. I will say that the relentless drive to get more lumens per watt versus more C ability, if you will, is one that designers ought to be on guard for, because sometimes the ways to get more lumens is you end up with an incredibly blue-rich fixture to begin, a blue-rich light source to begin with. And so I think that on the side of those designing buildings, we should be a little skeptical from people always trying to increase the overall light level, and what we need to concentrate on is viewability. And I think that 2-4 years from now, the color mix will be different as tunable light fixtures become more economical.
Okay, and then we have one question for Larry. Have any medical organizations agreed to work with the BPI Healthy Home Evaluators?
I'm sorry, I missed the question.
I'm sorry, let me repeat that real quick. Have any medical organizations agreed to work with the BPI Healthy Home Evaluators?
We don't have medical associations yet, but we are working in kind of pilots in different states, like Connecticut, a Medicaid pilot there. We're working toward doing one in Nevada, and there's a pending one with NYSERDA in New York State on a Medicaid pilot. I think the results of those will open up the question of whether hospitals can specify using a healthy home evaluator to go in and report back to the medical community. This is a model that Children's Mercy Hospital uses in Kansas City. Kevin Kennedy's group is assigned to go out and evaluate the home on behalf of the doctors in the hospital and report back to them. So I think we'll see more of that happening in the near future.
Great, thanks so much. Well, we have to leave it there, but I want to thank everyone for joining today's webinar. Once again, if you would like the credit hours for this, there's 1 credit hour available from the American Institute of Architecture. If you wish to receive this credit, please send an email to jrdenson@rdenson@aceee.org with your first name, last name, and your AIA ID number. We'll also be sending around a link to the recording of today's event to registrants in the next day or two, and you'll be able to find it on ACEEE's YouTube page. There's also upcoming conferences here that are on screen that you should check out, and registration is available at aceeee.org/conferences. Well, great. Thanks so much for tuning in to today's webinar, and thanks so much to all of our presenters, and enjoy the rest of your day.